Well, today we have Dr. Shailendra Goel and he's practicing in Ghaziabad and Noida. Well, today we're going to be talking about kidney stone management. So it's always better to have a word with the doctor before getting into any conclusions. So very welcome, sir.
Thank you.
Well, the very first thing which I would like to ask you, why do you think the number of cases when it comes to kidney stone is on the higher rise and constant rise these days?
Kidney stone has been an ancient disease. In our Ayurveda and our Shastras, there have been the equipments and treatment has been prescribed in Ayurveda also for kidney stone, bladder stones. So this is not a new disease. Our population is rising, the cases are rising, awareness is rising because of the media, awareness is very there. So the cases are now coming forward, and now with the education by this media and by the urologist available, everybody is now knowing that Mutra Rog Visheshagya, urologists are the right doctor to treat about the kidney stones problem.
Well, that's nice answer actually. Well, I would also like to ask you, what has been the most challenging case when it comes to kidney stone in, of course, your career, and how you dealt with and how you removed the patient's stone? One of the most challenging. Could you please recall?
Challenging, one type of challenge is ki how difficult case is for me, and another type of challenge is ki how critical for the patient life it is. It may not be a very critical stone, very difficult stone, but it's critical for the patient's life. We have come across the both type of the situation with a lot of equipments like lasers, endoscope, thinoscope, miniscope, microscope, micro PCNL, RIRS. We are able to treat all type of stones. But when it comes to the criticality of the patient life, he is a solitary kidney, one small stone is blocking his channel and the kidney stop functioning and the patient is on dialysis, and we remove the stones and the patient's kidney functioning and he is back on the life.
Wow.
That is the criticality of the patient that matter me more. Of course, we deal all type of patient, difficult case of course thrills us, but saving the patient's life is more thrilling.
Wonderful. Well, in your experience, what precaution a person can take or a patient can take in order to avoid the existing stone, and of course to avoid, if he had one and he's out of that, he's free right now, in order to avoid the recurrent stone, because there are many cases when the matter of recurrence happens. So what could be the precautions?
So in India, everybody is a doctor. Where you are, if the patient is, even if the patient is admitted in the hospital, the persons who are coming visiting him is also give some advice regarding the food. बीज वाली चीज मत खाओ, हरी पत्तियां मत खाओ, ये मत, और बियर पियो, ये दवा लो. Everybody gives advice. And in India we know, even in मंदिर, दादी जी, पड़ोसी वाले, ये बाबा, वो बाबा, local doctor, jhola chhap doctor, beer, everybody has the treatment modality, and most of the time they are successful also.
That makes it
That's make a more misconception, more
realistic,
look realistic, because they are successful. उसने दवा ली थी, उसका stone निकल गया.
What makes that successful? Could you please tell us?
So the reason is this: most of the small stone passes by its own.
Yes.
So when it passes on its own, and whatever doctor you have consulted, whether it is a doctor or non-doctor, and whatever modality you have tried, you give credit to that.
Yes, because of that.
But if all these are successful, then today nowadays every hospital has invested in crores of rupees for treatment of stones. Every day lot many patients are being operated. If really these were the successful, then nobody must have come to the hospital.
Of course, yes, that's the true case.
So it is the misconception, but whether it is really a misconception or it is a wrong knowledge, I would put it as the wrong knowledge.
Yeah.
Ayurveda, homeopathic, I can't say the science is wrong. It is the assimilation or it is the application of the science is wrong. Because who are doing the Ayurveda, they are not educated much. Top creams of educations goes to the allopathy sides. Who selects the homeopathy and Ayurveda? Those who never get selected to the good stream. They are not applying the science properly. These all alternative methods, alternative medicine, Ayush medicine are successful in preventing the stone. They are not a treatment of a stone. You can't gulp a medicine and stone will break like a dynamite and nothing happened to the body. आपकी जीभ निकलेगी, आप निकलेगा, स्टोन गल जाएगा या स्टोन ब्लास्ट हो जाएगा. Hard to believe. But these medicines are changing the milieu of metabolism or the urine changes so that the stone is not forming at the crystal level. So they prevent the stone formation. They cure the disease of stone formation. कहते हैं ना कि आयुर्वेद क्योर करता है. एलोपैथी में हम क्या है, जो स्टोन बन गया हम उसको ट्रीट करते हैं. अब वो पेशेंट पूछता है कि सर दोबारा तो नहीं बनेगा, हम कहते हैं दोबारा तो बन सकता है. तो दोबारा ना बने इसके लिए बनता है कि ये जो दवाइयां जो हम कहते हैं, ये दवाइयां दोबारा फॉर्म होने से बचाती हैं. रिगार्डिंग द डाइट इज ए मेजर क्वेश्चन कि ये मत खाओ वो मत खाओ. यदि हम उस लिस्ट में आते हैं, कहते हैं वेजिटेबल बंद कर दो, मिल्क बंद कर दो, नॉन वेज बंद कर दो, हरी पत्तियां बंद कर दो, बीज वाली सब्जी बंद कर दो, खाएगा क्या आदमी? वही तो कहेंगे कि गोले का वो नारियल का पानी पियो, बाजरे की रोटी खाओ. पेशेंट जब बीमार होता है वो 2-4 दिन, हफ्ता, महीने भर ये फॉलो कर सकता है. बट दीज आर नॉट प्रैक्टिकल. एंड नॉट प्रैक्टिकल के अलावा ऐसा कोई बहुत साइंटिफिक एविडेंस नहीं है कि इससे बहुत कुछ फर्क पड़ने वाला है. ये आपकी किडनी का इंटरनल मैटर है कि वो किस केमिकल को ज्यादा एब्जॉर्ब करके ज्यादा एक्सक्रीट करती है, चाहे आप खाना कितना भी खा रहे हैं. तो जो मेजर एडवाइस रिगार्डिंग द डाइट है कि एक तो पानी का इंटेक अराउंड 3 लीटर होना चाहिए. कहते हैं ना ज्यादा पानी पियो. कई बार लोग ज्यादा पानी के चक्कर में 10-10 लीटर पानी पीना शुरू कर देते हैं. ज्यादा पानी मीन्स कि आपका यूरिन का वॉल्यूम अराउंड 2-2.5 लीटर होना चाहिए. तो 3 लीटर पानी यदि आप पी रहे हैं तो that is sufficient.
So, is there any problem if somebody, for example, his body requires only 3 liters of water? That's more than enough. And he is doing the binge drinking and he is drinking 5 liters, 6 liters. So, is there any problem if he does that?
नहीं, आपके ऑफिस में यदि कोई बंदा अच्छा काम कर रहा है तो सारा काम वही करेगा, बाकी कोई नहीं काम करेगा, सारी फाइलें उसी पे चली जाएंगी. तो किडनी यदि अच्छा काम कर रही है तो लो जी आप 3 लीटर का काम कर रहे थे तो तुम 10 लीटर निकालो. तो यू आर एक्चुअली देयर विल कम द फैटिग फिनोमेना. तब आपको दूसरा है यूरिन बार बार जाना पड़ेगा, किडनी को फैटिग होगा. आप ओवरबर्डन क्यों करना चाहते हो किडनी को?
राइट.
बैलेंस डाइट या ऑप्टिमाइजेशन इज मींस की ऑप्टिमाइजेशन. देयर इज every element, there is a, if excess of good is also bad.
True. Well, what do you think is going to be a major breakthrough when it comes to kidney stone domain?
Major breakthrough is the science. We are getting equipments, the laser. We are operating the patients with the minimum complications, minimum problem to the patients, minimum bleeding, good results, and education. So that the patients are presenting to the doctor at a very early phase and avoiding the wrong knowledge कि नहीं यार ये दवाई खाओ निकल जाएगा, दर्द खत्म हो गया तो हम डॉक्टर को दिखाने नहीं गए, ये चीज.
Right. Well, what are your go-to kidney stone management solution to your patients?
My advice to the patients are, one thing, the stone formation is the patient's something kidney disease, and ultrasound is one thing that is totally not specific. Most of the persons, most of other pathies are doing the ultrasound. They get the ultrasound, one time it is a 5 mm stone, next time they come with a 3 mm stones. मैंने दवाई खाई, मेरा stone छोटा होने लगा. That is the ultrasound is just like a shadow. My shadow can be a 6.
That is all cursors.
Depending upon which angle the light is coming. My shadow may be 10 feet or my shadow may be a 1 foot. But I am exactly here at like 6 feet. So ultrasound, even if in a day 2 times you get the ultrasound, you will get a different report. Small stones, not very accurate ultrasound. Big stones, it is a stone, but exact size you never know. So the CT scan, of course CT scan is accurate, but you do not, it is costly and it is not advisable for every person. So the following or ultrasound, and ultrasound is showing the size is lessing and all, this adds to the misconception. So the
Right.
proper knowledge is the key.
Right. Thank you so much, sir, for your valuable insights. We are very glad to have you with us. Thank you.